Hi friends, welcome to AIDENS Vlog. Today I introduce you to how to insert central venous catheter. Central lines are inserted to those patients who have difficult to get peripheral vein. Central line consists of three types: internal jugular, common femoral, and a subclevian vein. In this video, we show subclevian incision. CVP kit consists of introduced needle with syringe, Y needle, gate wire, vasodilator, and a catheter with three ports. First of all, take a cut-down tray with all surgical equipment. Hence, it is a highly sterile procedure. We need all aseptic technique for this procedure. Check the prominence of the subclavian vein. Clean the area with betadine and then after chlorhexidine. Apply local anesthesia to the entire site. Insert the introduced needle into the site with 20 to 35-degree angle. While pricking the needle, we see the blood release in the syringe. Check whether it is a venous or arterial blood. With the help of Y-induced needle, insert the gateway and hold it. Dilate the lumen with dilators. Insert the catheter and remove the gateway. Check the patency of the three ports by withdrawing and releasing the blood. Clean all the ports with normal saline. Fix the catheter with fine sutures. Fix the catheter with adhesive tape or even tegaderm. In every 72 hours, change the dressing of the catheter. Finally, a chest X-ray is needed to see the proper placement of the catheter and or any air embolism to see. For more information, go through Google search. Thank you for watching my video. Please like, share, subscribe my channel, Athens Vlog. Thank you.